welcome back to my YouTube channel. And on Nurse Clement B today, I'm going to teach you or I'm going to demonstrate the nursing's responsibilities in blood transfusion under the following heading: before, during, and after blood transfusion. So, do not forget that before you start any procedure in nursing, you have to set what? Requirements, of course. You have to set your requirements, and of which this is my requirements. My emergency tray containing furosemide, hydrocortisone, promethazine, normal saline. And this is the blood that I've collected from the blood bank, of course. This is my tray for vital signs. Remember, it is very important when you are transfusing blood, monitoring the patient's vital signs is very, very important. So my requirements is set, and of course I have my patient's file, which I will cross-check, isn't it? So the next thing is for you as a student nurse to come to your patient, introduce yourself, obtain consent, right? So now, good morning. How are you today? Please can you tell me your full name and your date of birth? So, as the patient is telling you his or her full name and date of birth, you cross check it from the file to see whether it matches, right? And you check it again. So, I am here. Today, I'm going to be your nurse for today. So, I'm here to transfuse blood. Remember, the pack said your red blood cells have come down, right? It's low. So, I'm going to transfuse pack cells to your system. So, only the red aspect of the blood. Remember also, as a student nurse, you have to explain the procedure clearly to your patient so that you can obtain consent, so that your patient can agree to the procedure you're going to carry out. Right? So, Miss Helen, can I continue with this procedure so that to make you feel better? All this, the sick, the dizziness, the headache that you're feeling is because all the symptoms you're having is because your blood level has come down, has reduced, isn't it? So, can I go ahead? Okay, thank you very much. So, now I'm going to perform hand hygiene. Remember, it is important for you to perform hand hygiene. So, let's go to perform hand hygiene. So I have performed hand hygiene and I have dried my hand. So the next thing in this procedure is for you to don your glove. Remember, this is not a sterile procedure. It's a clean procedure, right? So protect yourself as a nurse. Don your glove, right? So the, the doctor has prescribed pre-transfusion medication. So the next thing, if you are doing this procedure, is for you to administer the pre-transfusion medication. Most times, the patient is being placed on furosemide. So I pick the furosemide. Of course, remember this is a dummy, and I may not break it. So break the medication. Withdraw the medication, of course. Discard it, and then I break and I withdraw my medication. So the next thing is for me to administer this medication. So I open the cannula, administer the furosemide. I'm done. Then I close immediately, right? So the next thing is I will discard into sharp box. Don't forget, before the transfusion, one of your responsibilities is for you to check the patient's blood group. Does it match with the patient's blood group in the file? Then also check all the investigation. For example, HIV. Is this blood HIV negative? Hepatitis negative? Right? As I mentioned, the rhesus factor, also you check. All the necessary information, you check it and cross-match it with the patient's information from the lab, right? So now I have done all this and I've checked it's okay. So, and the next thing is for me to take my patient's vital signs. Vital signs is very important. So, during exam, some students forget not to put the cuff, the BP apparatus cuff, into the patient's hand, feeling that their time is going. Please do not do that. Make sure that you check your patient vital signs properly, because there are marks assigned. There are marks indeed assigned to each and every step. And I know as a student you wouldn't want to like miss any mark, isn't it? Even if it is quarter, it is important for you to get that mark. So now you place the BP apparatus. Make sure you press the start button. Of course, you press the start button during exams. Do not forget. And then the next thing is for you to place what? The thermometer. And of course, I'm using use the spirited swab, clean from up, of course, down, discard it in a receiver for your swab. Then you put it under the patient's axilla, right? So you leave it there after, remember, after when you're done, then remember, and after when you place the thermometer, you count your patient's pulse. Count the patient's pulse for 1 minute, after which you count the respiration. So you have taken the patient vital signs before transfusion, right? Then you remove, clean with swab, discard, and then replace it inside its container. So the next thing to do is you can choose to leave the BP apparatus, most especially if you are using the distal hand. So you can choose to leave it there so that you can come and be monitoring the patient during blood transfusion. So permit me now to remove this BP apparatus, because I'm going to use this hand to transfuse the blood. So now the next thing is for me to connect, right? Blood giving set to the blood bag, right? So I'm using this as the blood. So I will hang it. Do not forget, when you want to fix you have to close control, close it, and then hang so that the blood will not spill on your uniform or on the patient. Don't mind me, don't mind my height. So now, then the next thing is for you now to expel air bubbles. So you don't have to spill it on the ground. You can use receiver. You can use a gallipot. Then, so you open the control valve, expel air, right? As you expel air from, as you can see, now I don't have air bubbles. I don't have air bubbles in the tubing, right? I have expelled air, as you can see. So the blood is ready for transfusion. And remember that before you hang the blood on the drip stand, right? On the stand, please note that if the blood is too cold, do not transfuse the blood. Make sure that you bring the blood temperature to room temperature. And for you to achieve that, please put the blood under a running tap water. Do not microwave. Do not put the blood back inside microwave. Use running tap water to bring down, to make the blood to room temperature, right? So I have hung the blood. So now I calculate the drop factor. How many drop per minute? Remember, the doctor could have indicated in the prescription sheet drop per minute before you calculate your drop factor, right? And we have calculated our drop factor. So don't worry, my next video I will show you, I will do another different video for how to calculate drop factor. So now we're done. I connect, I connect to the cannula, that which is being connected to the patient's body. So I close, right? So I regulate. Remember, this is a patient, it's a dummy. Of course, if I open it, will just stain the bed, right? So now I open, I regulate the drop, maybe let's say 10 drop per minute or 15 drop per minute, right? So I regulate it. As you can see, I regulate. So the blood is going. Now, your responsibility, so responsibilities as a nurse during blood transfusion. Don't forget, you have to take the patient's vital signs again. So you have to check the BP, that is blood pressure, and again, you have to check, pardon me, you have to check the patient's temperature, respiration. So now, after doing that, you keep doing this, checking the patient's vital signs, 10 minutes, 15 minutes, depending on the patient's condition. So I assume now I am done checking the patient vital signs, 15 minutes or 10 minutes. So I'm done, right? So I assume also now we are done transfusing this blood. And the patient did not have any reaction, right? So I disconnect the blood giving set, and I close the cannula and I hang it. Now, your responsibilities as a nurse, you don't have to discard these blood back. You have to leave this blood back. Each hospital, they have a place. So during exams, explain to the examiner, I will not discard this blood back. I will go and keep it in a place where it's been kept for blood transfusion. You have to keep it for at least 48 hours in case of post blood transfusion reaction. After that, but in case the patient reacted to the blood during the blood transfusion, immediately, do not forget, immediately you discontinue the blood transfusion. Discontinue the blood transfusion immediately, then, and take normal saline, fix it up immediately, and then take promethazine or hydrocortisone depending on the prescription from the doctor. Then you administer immediately. After that, then you keep monitoring the patient's vital signs even after the blood transfusion. The same thing when the patient is reacting to the blood. So I hope this procedure is helpful to you nurses and to student nurses. So kindly help me share my videos. And I want to appreciate you all for watching my videos, subscribing to my YouTube channel, liking it. Please keep it up. I love you all. I remain Nurse Clement B. Thank you for watching.